snippet, which is I feel there is a need to. Yeah, there's something. Yeah, there is a need to, like, most of us have been through this two grilling days, and it was a big kind of. I don't say it's overload, but we need to take things slowly, assimilate properly. The overdose is always causes some problem. Uh, my so the thing is, this is the topic given was about environmental toxins, and I was trying to scratch my head because this in 20 minutes, how much I can work it out. Okay, fine. We had some areas which I'd like to focus on, which is something called electrohypersensitivity. These days, I have seen some people like having some weird symptoms. I can share with start away go with a case study where a school teacher comes to me, and she had joined a new school, and she was having something like a just headache, and she was probably over exhausted and all that. But there is a story. Try to see the what exactly how things. As a clinician, you can always pick it up. So this is she joins a place, and she's quite happy with things and all that. And she couldn't be like yeah. Uh, Yeah. So the thing is, there's always a honeymoon phase during whenever you start something new. What I believe is that if you wear your new shoes, also it's bites you. So the first 3 months, that quite happy. She was into a proper this particular stuff, and she started complaining of headaches and some kind of illness which she was not able to tell properly. This was one of our one good family friends, so we knew what is the background, what is happening with that. So again, this 6 months went on, and I think this she started. She starts complaining of lack of concentration. She was bit angry without any much reason and all that. 25 is not the age. There were no hormonal issues and all that, but still she had. And the most important thing was the insomnia. The thing is, nowadays, every patient of you will come and tell doctor, I am not sleeping properly, I am proper, whatever things and all that. This is going to the big take. Insomnia is the biggest kind of thing now. So apart from insomnia, there was some tingling numbness in the hands and legs and all that. We started looking at all. Okay, there must be something to vitamin B12. We thought of must be some other thing. Somewhere something did help her out. So after brief evaluation and all that, she has, in fact, I was the sixth or seventh physician to check her. They went across different doctors, and she eventually went to a psychiatrist also, which William and all antidepressants were prescribed. So the thing is, in spite of that, she was not happy. In the sense, she has got always in her depression kind of thing. We used to think that there is some issues with the law, whatever. There are multiple reasons when we, from the Indian diaspora, we look into that kind of thing. We have to think about a lot of things. So this led her, and it's, I think, okay. So the thing is, after 2 years of antidepressants and all that, multiple diagnoses were given: chronic fibromyalgia, you name anything, depression, you name any multiple chemical sensitivity. So these are the things, and we are not. I think we are still not ready as physicians to take up this kind of challenging cases. We somehow tell that, okay, there is a problem with the brain here. You better go to your psychiatrist and keep on taking that. Are we justified in that? We need to look into that. And so, coming to this new paradigm of diseases, the new paradigm is electrohypersensitivity. The people are getting into. I'll share all the things which I'll try to go fast. I can share the slides also, not an issue. Uh, but I just want you to understand behind all these things, there is a thing called oh no, oh no. This is called peroxynitrate formation from this nitric oxide. And this is the biggest challenge how to manage this particular, because whatever you have understood till now, yesterday we are talking, we had a great talk about gynae and this particular thing. Everything we are talking about how it disrupts and all that, how is the blood-brain barrier gets breached, what is that intestinal permeability has to do. All this single person can manage all the things because it has got the ability, electrohypersensitivity can create something like blood-brain barrier disruption, something like leaky gut. Even the microbiome resistance is probably because of that. I'll share you a few of the slides and all that. Yes. So there is a certain relationship. It's a kind of thing which this is called cumulative effect. What this teacher has got through, we'll see later. But there's a cumulative effect of multiple chemicals, multiple a lot of toxins which are around. Along over and over, we have got this 60 gigahertz of Wi-Fi. Wi-Fi is 2.4 gigahertz, but nowadays what we are talking is about 5G radiation. 5G is 60 gigahertz. That if you can understand from a simple physics point, whatever gadgets which used to work with the telephone and all that was 60 hertz was there. That means 60 times every minute it used to get a pulse. Now you have got 60,000 gigahertz, so the kind of the concussion we are having is tremendous. 2.4 itself, I believe it causes a lot of issues. I think I will. So, what exactly, why a doctor with a radiology background entered into environmental medicine? So this is a big kind of thing. We were not a happy custom doctors trying to give every pill to the patient, telling that everything is in your mind and it's a depression is you can't this one. Why would like to go deep dive? What exactly happened to the teacher? So we stumbled upon the some years back when we started with Dr. Sri. We were like he's talking about environmental medicine. He's talking about nutrition. We were slightly puzzled. I was into something like clinical mental toxicology. I was only thinking about lead, mercury, cadmium causing diseases, and this gentleman was talking about as a whole kind of thing. But again, it's our good this one vibes. We got connected with him. And, this is how environmental medicine. And I am there is an Academy for Environmental Medicine (AAEM), and he there also the group of doctors just like this. They stumbled together and they started telling that okay, everything is not that one pharma intervention. Something has to be, it's a total kind of thing. I just give that simplest example. This is basically goes with something like dilution effect. Now, you see a obese person, you feel that he is eating a lot and all that. We had discussed enough about it, but it is the fact is this obese person has got environmental toxins and he's not able to the volatile organic acid, and your body tries to wall up that toxins in the form of lipid layer kind of thing, and that goes into the fixed deposit. So most of the fat biopsies what we are doing, we are getting a lot of organic chemicals in that, xylene, taurine and all that. So it's a big subject again. So this is already done in 60s and we are now trying to work it out. And this is the new paradigm we are facing. And I can always tell you that yesterday we were talking about Gen Z and all that. Yeah, this people have to take this seriously because everyone is not on the same page. I try to convince my family members also somehow for the last 6 years or 7 years, I was able to cut down that Wi-Fi router from my home. I disable the Wi-Fi router and I use that LAN cables. It's as fast as wireless communication. I've been picturing everybody to start getting into that mode because you can always check that veracity. If you are on the Wi-Fi, always on the Wi-Fi, stop, cut down for a week. On the seventh day, again you switch it on that Wi-Fi, this one, and you can see the difference what it makes. You will get that all the symptoms what we have shown now. So this is the new kind of things which is called it's a big era. This is called 10 days. Oh no, no, oh no, this is the kind of thing. I think Sunita was nodding her head. She knows more than me, I think. But again, we need to look at the cumulative effect. Exposure to chemical toxins, exposure to electromagnetic radiation, you have severe emotional stress and whatnot. So slightly complicated thing, but things revolve round, and all that. Why I just wanted to tell you is that this peroxynitrate, this is that particular thing which causes VGCC activation, calcium. We are concerned about why the calcium is getting deposited. I used to think it is only that vitamin D deficiency which is causing that, but I don't think it is sufficient enough. There is a kind of thing, intracranial calcification is happening. You have got a pineal gland which is getting calcified, and you are out here, out in the cells. Your diurnal rhythm, your sleep wakefulness cycle is gone for a toss. We, as a radiologist, we used to see for the pineal gland calcification. We are seeing in 6 years old, 10 years old, just a CT scan which picks it up. Calcification, we used to report this as a normal finding. We used to then we said normal variant. No ways. It cannot happen at the 6 years. It cannot happen at 20 years straight. We had seen something like basal ganglion calcification on CT scan, and we used to report this is a normal variant, Subara. So then we realized all this. I was trying to follow the per people. They are in for problems later. They are getting either Parkinson's, they are getting other degenerations and all that. That cerebrovascular degeneration, cerebral, all degenerations are happening at a rapid pace because of all these things. So it's slightly a thing complicated, but I can always tell you about this total body load. And if your body is not able to take up that total body load, it causes a disbalance. It disbalances the immune system, disbalances almost everything. A lot of things contribute. I'm slightly nowadays. I'm very finicky. My family member, they used to think that, "Arey, what is this? Why doesn't he wear a new cloth?" I can tell you, new cloth you need to whenever you purchase a new cloth, at least wash for 3 4 times, then you wear it, because a lot of formaldehyde is there in that. And we are finicky about using Surf Excel, and I'm not against this particular thing, but somewhere we are at the receiving end. So you need to be careful about all these things. There are so many things, and yes, Sri always gives me 20 minutes time. So this particular thing, I just wanted to tell you about what is this 2.4 gigahertz with this 2.4 gigahertz is there in all Wi-Fi. It is causing uncoiling of your DNA, and people have reported once you get that into thing, there is a what happens is that in the DNA and our DNA, you have got nucleoproteins and all that. The viruses get embedded there. And as long as they are embedded there, nothing happens. Once they uncoils, things starts. So I am fortunate to be Dr. Klinger's student. He has taught to us all these things. He said, in a case of a more radiation, and you have got this particular thing, you are bound to get into viral issues and all that, because that is the kind genesis here. So, antimicrobial resistance, this is the huge thing, and it's basically this EMF suppresses immunity. And yesterday, Arvind was talking about EBV and all that. This is really on the rise. We had the way we had grow thing. Your human body is capable of managing all the things. We used to get a common cold 2 days maximum and all that. Nowadays, if you get a small infection, also you get into a you there is a possibility you can get into ICU also with the smallest infection. This is what is changing our biological terrain. What I talk about biological terrain is you have to always, this is the fundamental of environmental and nutritional medicine. You are trying to build up your biological terrain. If your biological terrain is good, no matter whatever is the thing, it can be Ebola, it can be anything, you can manage with that particular stuff. If your immunity is not proper, I think I can go on and on. But one thing deserves a thing is that called blood-brain barrier. Blood-brain barrier gets breached with this stupid Wi-Fi and stupid electromagnetic field, and this is the reason why all of us are getting into fast into neurodegeneration. We need to learn something about neuroplasticity from Sri Kumar, and this is I think this is a big kind of take. People have worked. I can share you about 80 pages book of Martin Paul, and this is as a I felt I was doing all the things. I used to think that as a radiologist I have grip on all the other subjects, but somewhere this was absolutely we were led before the wicket in front of that electromagnetic field. I'll tell you why I'm so focused on that. This is I went to see a conference in Colorado where Dr. Joseph Markula was showing how to hold his cell phone. He was taking a selfie stick and he was holding like that. He never used to keep the cell phone like that. He used to put a silver mesh and used to keep in the pocket. That was in 2017, 16, something like that. So, but again, we had. I need to tell about this teacher's story again. Sri, we started with a teacher who got into a new school and got into psychiatrist opinion, and we started working on that case. And she was greeted with a new furniture. There was a lot of VOCs were there, all things and all that. She was not able to, she started having a migraine. Later on, went on. She started getting into tingling numbness and all that. The thing, we as a kind of thing, because I was the sixth doctor. So I said, maybe something is a issue. You have to take a rest or something like that. We asked her, in fact, to take a leave from the school, and she went for a 1 month leave, and she was good. The moment she comes back, again she gets into the same problem. In spite of using that Valium, in spite of using all that stuff. So we did some things which yesterday it was elaborately sold because of the time. I will just quickly go through that. But we had all the things, all whatever we Arvind and Sunita discussed. We started working on the same kind of things. It's again the essence of the thing. Coming to Dr. Sri's thing is you get that particular the protocol, how to go ahead with this particular stuff. What I want to tell you is what might have missed out. There must be something like a fresh paint, new carpet, inadequate ventilation. So this all the chemical load along with this electromagnetic fields where they cross. We did some things like I do some hyperbaric oxide and all that, but somehow everything was it helped this teacher out. And yes, I just wanted to put across, okay, what is the, all of this, but these are the kind of references you can always go for it. Niacinamide is such a fantastic thing. I think Leroy is not here, and you need to use this out of box solutions for this particular stuff, and simple things do help. I had a similar case, a girl getting into something called preparing for NEET examination. 16 years old girl getting into. Everyone said you have got high this one and all that stress and all that. She was not able to perform. The problem she came to me was intense headaches, and she used to fall down. There was a repeated falls, her BP was getting low and low, and she had tachycardia. She had a chest pain. She was referred to a cardiologist. That says, okay, we'll take up that particular thing. But again, it was a very messy situation. This girl wants to become a doctor like anything, and she starts working on that. The thing is, this particular girl had something called POTS, postural orthostatic tachycardia syndrome. Okay, POTS. The moment she gets up, she walks, her pulse rate goes up and the BP goes down, and she goes for a fall. She has got a vertigo and all that. So this is a new onset kind of stuff. It's really bothering for clinicians like us because we get all the leftover cases. But I can tell you all these things which helped her, just working on some saline, trying to work it out on some areas and all that. Spots, you should go back and see what is spots this doctor is talking about. So this appears very simple. It appears a kind of thing. I'll take 2 more minutes if you time permits. Okay. So as a doctors, what is the role we have got? There is a thing called precautionary principle, and always people keep telling, "Arey, how is it? Is it safe or whatever and all that?" So you need to understand this. If prove that it is not safe or prove that it is safe, this is always a tussle. Everyone talks about that. Then I have something which is called, we try to work on something called precautionary principle. We should get out until you can prove we won't be boiled alive. Thing is, this has become again a tobacco industry kind of thing, which was there in the 19th century. Now that everyone has got a cell phone, everyone wants to talk for hours on cell phone. Everyone has got a very good hi-fi router. The kind of thing is, uh, this is the history is repeating. Maybe another 10 years, 20 years down the line, we'll get all the things, whatever, still people have started working on trying to document things and all that. There were a lot of papers. There were 400 papers were presented telling about the safety of this. Out of 400 papers, only four papers showed that there is some correlation between the this EMFs and health. And all the 396 papers which was thing presented, they gave a clean check to all the things. You know who sponsored that? That was the industry who sponsored that. So all the four studies which were done from industry level was not taken into consideration. So there is a group called EMF scientists appeal. There were a number of people actually. They started talking about what is this EMF is doing, and you can go into emfscientist.org, and you can always download this. That's not a big issue. And only thing is, we were not taught about how to keep our cell phone switched off when we are sleeping. The biggest problem is not Gen Z, Ravi. It is going to be the new generation which is coming. A 3-year-old getting addicted to a cell phone is the biggest issue. And the parents are thinking the child is very smart and all that. But classrooms, why the classroom should have a Wi-Fi, should not be wireless communication. There is a Nicosia resolution in 2017 in one of the Europe nations, and they have said all. See, even if there are 20 or 25 taps in this room and all are running the Wi-Fi, we are getting fried. Okay, so you need to be careful about that. The children at that age, when they get this particular stuff, you can imagine what is happening to the blood-brain barrier. It's not a very big this one. Your pineals will get calcified, sleep disturbed, and the kind of thing. There is a studies which has shown the early you get in touch with the screen time, more screen time, within the children who get addicted to cell phone, at 40 years they may get Alzheimer's. Alzheimer's biggest causes this radiation. So electrosmog and all that. What are the? There are always possibilities. There are some things. Even the WHO is now telling that there are some issues with this particular stuff. And yeah, I can go on and on. Any questions are there? I can always take up. Bio initiative group is the keyword. You should use it. Interested people. And autoimmune rise, we believe, is because of so many things. And antimicrobial resistance. A person who gets into ICU, you think how many antibiotics he's taking? He the whatever you do, his counts cannot come down. Multiple this particular stuff you need to go imipenem and all. That's a norm these days. You have to give the highest antibiotic. But again, still there's a issue because this is totally depleting your microbiota. We feel that we are just giving a lot of this stuff. This is a danger, I can always tell you. So I can always this is there is some studies and all that. Yeah, this is repeating. Yeah, I think I'll stop it here. Sri, I think you have some. Yeah, this is what exactly I spoke in 2019 to a students, ninth class students in Delhi Public School, Hyderabad, and they gave me that. I was talking about cell phone menace. That time not much data I had got, but somewhere I was able to not convince, but they saw there is something is there. So I think we as a group should start talking all in our group. Number one, our family and friends and schools and all that. If we can reach out them, we are going to